So one of the first questions that patients or parents have when they come in is, how are things going to be different? If my patient, if my son or daughter, or if myself starts in braces, how's my life going to change? And so it's nice to give some specific answers as to, how often do you need to come in and see us, or is there going to be any change to your diet? Is there foods you are encouraged to eat or foods you're discouraged from eating? What if my son or daughter play sports? Will they need a mouth guard? Or after the braces are off, are retainers involved? What are some of the changes we should expect? And so we like to have to be able to explain that well enough so people can have an understanding of, what am I getting myself into here? Each patient that comes in receives a specific treatment plan from either Dr. Ghosh or myself, or both of us together on some of them. Depending on that treatment plan will dictate how often the patient needs to come in to see us. For most of our patients that have full braces and has a pretty standard path with the braces, we'll see them usually about every 6 to 7 weeks. Each time the patient comes in for a braces adjustment appointment, they'll see either Dr. Ghosh or myself and the assistant, and we'll decide, okay, where are we at now? Do we need to change a wire? Do we need to do a minor adjustment here? All with the focus on how do we get from where we're starting to our final goal in the most efficient way possible, but also keeping into mind the specific biology which comes with tooth movement. We believe in a philosophy of light treatment forces that allows the teeth to physiologically move like they should, allowing all the proper biology to take care of itself in a way that minimizes the discomfort for patients. When you first get braces on, your teeth may be a little bit sore, but we try to minimize that through the actual ways that we design each adjustment. Now, for some of our other patients, depending on the treatment plan, the treatment visit frequency may be a little bit different. For example, if a patient is going to have an expander, when that expander is initially placed, we may need to see the patient for 2 consecutive weeks right after that, so we can guide that expansion exactly how we need it to be. Now, after the expansion's done, we may see them in 2-month intervals until we're done with that treatment process. For some of our other patients that may be in a more holding phase, they may have a space maintainer, and we're watching growth and development, watching loss of the baby teeth and the eruption of the permanent teeth. We may see them every 6 to 12 months. And so it really depends on the exact treatment plan, how often you need to come in for an office visit. One of the biggest changes for most of our patients comes with their diet. When you first get your braces on, usually for the first 5 to 7 days, your teeth can be a little bit sore. And so we'll encourage you to eat softer foods for those first few days, just as you're getting used to it. Your teeth and your gums need a few days to settle down and get used to that movement. After that, you can usually go back to your normal diet routine with a couple exceptions. There are specific things that can affect the function of the braces on your teeth. Some of those things include caramels or sticky foods like Laffy Taffies, hard candy, Jolly Ranchers, strong hard mints, things like that you could imagine biting into that can either get stuck in your braces or pull your braces off. Usually when a bracket comes off, it's not a huge problem. We see it from time to time and we can fix it. But what starts to happen if that continues over time is you'll find that your treatment time ends up getting a little bit longer. And so we give specific instructions on that. Another thing with a lot of the sticky foods is most of them have some sort of sugar in them. And so you can imagine if you're eating sticky foods and it's getting stuck in your brackets, it's like adding little pockets of sugar right on your teeth. And so over time that can lead to increased cavities and things like that. One of the important things to realize is when those braces go on the teeth, it's easier for food particles and other things to get stuck in there. And so being diligent with brushing and flossing becomes very important. After the braces or an expander or anything else goes on, we always spend a a significant amount of time with parents, patients, whoever's there and is going to be involved in keeping the teeth clean. Specific ways to floss, specific ways to brush, to make sure everything stays nice and healthy. Healthy teeth will move faster and be more comfortable as we go throughout treatment. We always, as dentists, encourage our patients to brush at least twice a day and to floss once a day. We'll continue that with braces. Depending on the need, that may even increase. We may encourage you to brush after lunch if you can, just to get the bulk of the lunch that may be left over off the teeth and clear everything out and keep everything nice and clean and healthy. So oral hygiene becomes very important with braces. It's important when you have the braces on and you're playing sports. You can imagine getting hit in the mouth. That could, for one, it could do damage to the bracket. It could knock your braces off your teeth or move the wire in a place where it shouldn't be. But two, you can imagine it wouldn't be very comfortable to take a blow to the face and could potentially have some damage to the gums or the lips or other soft tissues. And so we always work with our patients, making sure we get a good mouth guard option for them to wear with their braces. So the treatment doesn't completely end when the braces come off. Each of our patients will be given a customized retainer or set of retainers for their teeth. If you think about it, think about how many people have been invested in getting this smile to where it is today. There's the patient, there's sometimes a parent, there's the orthodontist, all the assistants, the front office staff, families. We've all put so much time and effort into getting the bite and the teeth where they're at. So we always encourage to move forward with good retention to make sure that stays where it is. Each of our patients will be given specific retainers for their teeth. Sometimes that may include a fixed retainer, a retainer that is bonded on the inside of some of the teeth so it's not visible but can serve as an extra support and retention as the patient continues to grow and develop. Or in addition, some removable retainers that you can put in and take out. Initially, we'll have our patients wear the retainers if they've been through a full set of braces day and night for at least a couple months, and then is eventually coming down to 1 to 2 nights a week. If they're a younger patient, they may have had an expander or some limited braces on the front. We usually design the treatment plan so once that treatment is done, they can wear the retainer just at night, and that eliminates a lot of lost retainers from the lunch trays and things like that. But retention becomes an important part of finishing off the orthodontic treatment just right. So we keep that nice stable result as we go forward into the future.